coordination going on behind the scenes, as you know, between all the directors, the fire department. Our emergency coordination manager, Stephanie Hackett, is here to do a brief presentation. I'd also like to thank the City Attorney's Office, Lena and Jack, who's just back from vacation, for preparing these two resolutions for your consideration tonight, addressing a couple of important issues as we go into response for the COVID-19. Stephanie, if you can just do a brief update, and then we can do question and answer on any of the three items at your pleasure, Mayor.
Okay.
Yes, thank you. Well, thanks for having me in tonight. So as you know, we're here to take a look at the emergency declaration, hopefully get that signed off, be able to answer any questions you guys might have about it, its purpose, and kind of how it serves us here in the city. Before we do that, I figured I'd give you just a real brief update of kind of where we are and what we're doing, and then make sure you have the chance to ask questions and kind of get a sense of what we're doing both within the city and then also outside the city. So thank you for putting this together, Marv. So I want to make it really clear. So we did kind of something really unprecedented this week, and we're going to go ahead and we're going to close city facilities to the public next week. We did this morning just get our second presumptive case located here in Brighton. So as we know, those numbers are going up, and despite what we're going to do, those numbers are going to continue to go up. It's inevitable. And there's evidence in city and county of Denver that there's now community spread of this. So the purpose of closing the facilities to the public and really promoting that social distancing message is not to, make the virus go away. It's not to, try to not have people get it. People are going to get it, and we kind of know that's what's going to happen, and that's what the epidemiology tells us. What this does, and it's I think they're starting to use the flatten the curve graphic here. But what this does is still the same amount of people are going to get it, but what we're hoping to do is to spread that out over a longer period of time. So if we have, for example, 250 people who get this virus and who need hospitalization, it's much better to have those 250 people present to the hospital over the course of 2 or 3 months than within a week or two. So that's really the purpose of why we're kind of promoting the social distancing and why we're really trying to slow the spread of it as much as we can. There's only so much we can do about the actual virus, but there's things that we can do to mitigate the time frame and mitigate the impact on our healthcare system and our hospitals. So I just want to make that clear. So as the next few weeks, I would expect that we're going to see the numbers here go up like everywhere else. I think as of this morning, we had 101 cases in the state of Colorado. That we're going to continue to see that, but we're going to hope to see that at a slower rate than a potential exponential spread of this. So just want to make sure that that's kind of clear and give you guys a chance to ask any questions if you muster on that. So one of the things that we're doing here is with our PPE for our first responders, so our police, fire, EMS, we've got a decent cache that we've got for folks who are responding to folks who are either suspected to have some type of respiratory nastiness or actually confirmed to have the virus here in town. So we've got good caches, we've got good PPE right now, and we're monitoring those caches as we're going through them. It's really hard to get resources right now, so in anticipation of needing resources, we've gone ahead and ordered masks, gowns, eye protection, and gloves from CDPHE. We don't know when we're going to get those, if ever. But we've gone ahead and made that order on behalf of the city and the fire district that way. And then we've also worked with private providers, and hopefully Amazon's going to be delivering me some stuff at the end of the month. So even though we're in good shape right now, just anticipating those shortages, we're doing some resource ordering kind of preemptively right now. So the hospital, working very closely with the hospital and their incident command system. Right now, they're really gearing up to do a lot of testing. So they've got a great negative pressure room, a really good flow of kind of people that keeps the people that are coming in for testing kind of separate from the rest of the hospital. So they've been working on a parking plan, kind of a patient flow plan, a staffing plan, to make sure that they can do that testing as efficiently as possible. Right now, they're just really starting to ramp up, but they haven't been inundated by folks going in for testing, so we're kind of waiting to see what that actually looks like. Their incident command center is activated, and we are integrated into that. Right now, they're looking at supply chain issues, but they're also kind of facing forward and leaning forward and looking into activating their alternate care plan. So if we do have a medical surge and we do have folks that are coming into the hospital that are more than what they can handle on a regular basis, there is an alternate care and alternate surge plan that they have the ability to activate. So while they're the lead on that, that's something that we support them in doing. Also been working with our long-term care, assisted living, and our nursing home facilities here. You may be aware, a couple days ago, they had a public health order that went out to them that restricts visitors to those facilities, and it also suggests restrictions of gatherings and putting people together and having activities within the buildings to try to promote that social distancing. So I've been working with them and kind of cool because on our end, we're not a regulatory agency, so we can just call them up and say, hey, how's this working for you? What's working about it? What are your challenges? We're the city, we're here to help. So right now, it's kind of a new normal there, but they're all doing pretty well with the new regulations. Most people are doing okay with PPE, but again, looking forward a month, 2 months, and knowing the supply chain management issues, we're looking at making some orders on behalf of our long-term care facilities to support the folks over there as well. Lots of coordination, all conference calls all day, so fun. So we're coordinating resources, we're coordinating information sharing, kind of where we all are with our declarations, where we are all with our closures, our openings, our school districts. So we have several standing conference call coordination meetings that are set up on a regular basis. So it's emergency management along with Tri-County Health Department, all the emergency managers within Adams County, all of the state agencies, they do a state coordination call. We're setting up a North Metro area emergency managers conference call. And then Marv, I think we have a new one added to the list with Adams County leadership and emergency management that will be starting next week too, just to make sure that we're not missing things and we're all sharing information and whatever problems come up in one area where we're helping to try to solve those with other folks' solutions and to be able to kind of put those together. In terms of potential assistance, so I don't have a lot of great answers about what that's going to look like quite yet. I've been told that by mid to the end of the week, next week, there may be SBA grants available, so Small Business Association grants, which are essentially very, very low interest loans. A lot of times those can be made available to both businesses and individuals. It just depends on what that looks like and how they decide to kind of structure that potential assistance. So I guess we as the state of Colorado have not been approved for that yet. They're hoping to get that approved early next week and then get the information to folks out about what's included in there and who's eligible to apply. So that would not be a government grant. That would be a kind of a community-based grant. So as soon as we get information about that, we'll be sharing that with our partners and making sure folks know that's an option that's available to them. As you probably know, Trump declared a national disaster a day or so ago. That has the potential to open up public assistance to local governments. But until we actually get the information from FEMA and that flows down through the state, we don't actually know what that looks like. So I was asking them to speculate and say, what do you think it might look like? And what might those opportunities be? And they wouldn't give me anything. So it's something to kind of keep our eyes on and keep our pulse in. But we just don't have a ton of information. So moving on, just in terms of the assistance piece, we're going to be working really closely with DOLA and then also with DHSCM. And kind of a second piece of that is internally here, Maria and her finance team have done a great job on really kind of looking at and updating our finance and our emergency policies and a lot of our paperwork there. So we've got some great tools that are going to help us track our staff time. They're going to help us track the resources that we're ordering here. And if and when assistance does become available, we'll have some good paperwork available. And, we know that we need to start tracking now as opposed to later and trying to put it back together. So that's something that we're working on as well. We also have a centralized account that we've just opened as of Friday for all of the COVID-19 related expenses to be charged to, which will help us to consolidate and get a better picture of kind of how much money we're spending on this and in kind of a real-time basis. And then that's really all I had. That was longer than I meant to go, but so that's just kind of an overview of kind of what we're doing, both here, but then also in connection with the region and the state and our other partners. So.